he is specialist in physical medicine and rehab. He is also a clinical associate professor at UBC. He is also attending physician on the inpatient neurovascular program and also part of outpatient brain injury program and MS and GF at GF Strong Rehabilitation Center. He is there for the post-stroke rehabilitation and he is the leader of the Strong program, and he also participated in New Westminster. That's his hospital-based consulting practice in the hospital, and with that, he's the director of New Westminster of the rehabilitation program, community-based. His focus is patient, adult, teenage, the adult patient, about the post recovery when the muscles are stiff. We are very happy to have him to be the part of this presentation. And then family caregivers of British Columbia, Victoria Lougheed, family caregiver of BC, and next Catalin Archibald. She is from Heart and Stroke Foundation. Now we will listen to about the two organizations, how they support and what resources they have for our patients. So I will ask, I'll ask your first presentation is Dr. Chahal, Dr. Preet Chahal. He will be starting now. Welcome. Thank you, Dr. Chima, for such a warm welcome. Welcome everyone, all the listeners. I thank you, everybody, and iCON team who give me the opportunity to present. So, what is stroke? What could be done to manage it? I will try to speak in Punjabi, translate in Punjabi. There are some words when I speak Punjabi, like stroke, we should say stroke, not lakwa, because there will be the whole population will be confused. Let's say heart attack to heart attack. Allowed to take questions. So the mainstream word in the mainstream, the word is used stroke. So we'll keep it a stroke, and we will explain it clearly how we. So there will be you heard detailed presentations yesterday. So I want to add to all those presentations. All right. So today's presentation. What is stroke? My main objective is what is stroke? What are the types of stroke? What they are? If you get a stroke and you have to go to the hospital, what could be done? How we can manage it? And the other point we discussed about it yesterday about the chronic diseases, the diseases you are having it a long time, diabetes, blood pressure, how we can manage, how we can treat them, why is important, how we can prevent stroke, how we can prevent the stroke, how we can manage the chronic diseases. The second thing is if the stroke happens, what we can do for the recovery, if time permits, whatever practice, whatever I have experienced from my practice, I can present that too. What is stroke? The main thing is what is stroke? The stroke happens when in our brain when there is no blood, there is a blockage, because in the blood vessels there is a blockage and there is no blood supply to the brain. Those arteries that get plugged, there is an interruption of blood supply, and then slowly the brain, then the brain part of that of brain started dying when there is a blockage. The big thing is during my practice I have seen that there is a lot of awareness about heart attacks. That's what we called Dil da Daura, that there is a chest pain, I was having difficulty in breathing. So there are circumstances that if there is the pressure on the heart, that something bad is happening to me. People are aware of that. But about stroke, yeah, it's an attack of the brain. The stroke is the attack of the brain. There is the effect on the brain. So there is an interruption in the functioning of brain. So that's what we need to understand. When we talk about stroke, we are talking about brain. When we are talking about heart stroke, we are talking about heart. Sometimes I hear there is an attack. And then I have to ask, what attack? Where did you go? And then they say, my relative got an attack. So are they talking about the heart attack or are they talking about the brain attack? So in our community, we need to make it aware in the community to make sure what kind of attack. Is it a stroke or heart? So if it's a stroke, it's the brain. So now types of stroke. When the stroke happens, our main objective is why this stroke happened, what are the causes, what kind of stroke it is. 85% strokes, the strokes happen because of the blockage. There is a blockage, that's why the stroke happens. 15% of the stroke happen because our blood vessels, our arteries, they burst, they rupture. So where the blood is supposed to go, it doesn't reach there. It doesn't reach to that part of the brain. So the main type of stroke, it's called ischemic stroke, is caused by the blockage. These two pictures are about these two pictures are showing the concept. On the left side, when the blood is, there is a blockage on the way, and then there is a blockage, and then it doesn't reach where it's supposed to reach and provide nutrition. Then the oxygen cannot be reached where it's supposed to reach, and then the part of that brain start dying. And on the left hand side, there is a no blockage, but where the blood is going, and then it ruptures, and the picture is shown, then the blood wherever it wants to go is not going. So the nutrients are not reaching where they are supposed to reach. So there is a blockage. So that's what we need to understand. When the stroke start to happen, when the blood doesn't reach, 2 million brain cells are dying in 60 seconds. They are at risk. 2 million cells are at risk. That's why we are telling you, as soon as you can, you notice the symptoms, as soon as you notice the symptoms, call 911. So the chances are great, so we can prevent the loss from the stroke. We can prevent that loss. In English, we say that time is brain, because you need to act fast. So whatever minutes you can save, you should save. So we can reduce the risks. This slide, commonly known as, it's an acronym. We can easily recognize what are the symptoms immediately that starts to show up. Face, F for face. If the face is drooping and is getting loose, and then you can't move the bottom part of the face, so can we raise our both arms? If the arm, one of the arm is dropping, then there is a weakness in the arm. The third thing is speech, and then you are mumbling, you are not you are having slurred speech, it's not clear. So these are the common symptoms of the stroke. If you get you have any of these or all of these, then we understand this is the time that you are getting stroke. It could be stroke. So please call right away to the emergency, call 911. So don't ignore it, don't go to the clinic, just it is a medical emergency. Treat it as a medical emergency. If it's happening to you or somebody other, this is the recognizing sign. T is like time. So call as soon as possible. There is another concept in stroke. This is called TR, transient ischemic attack. It's a short, small, mini stroke. So in what we call it small stroke in other languages, like, because we use it small, we are not making it important then. So it's nothing small. It's a stroke, is a stroke. Yeah. So in mini stroke, the part of small part of brain is dead, but in big stroke, it's the bigger part that dies. But we shouldn't take it lightly. The mini stroke shouldn't be taken lightly. So it's the same symptoms like face, drooping of face, the slurred speech. So in a few minutes, you recover fast. In this stroke, you recover fast. But we think, okay, we are now okay, we recovered. But it's an equally urgent medical emergency. We should pay the equal attention to this kind of stroke. Then the rest, when once you get mini stroke, the risks are higher for the bigger stroke. So we must pay the urgent attention to this mini stroke. In my practice, I see that son, I went to bathroom, my right part was not working. I thought maybe I slept on the wrong part. Maybe I'll look it in the morning. I will look after it. So the time is gone. So don't rather than giving yourself a reasoning, call emergency as soon as possible and investigate it right away as soon as possible. So next slide. So what is the treatment process? If we think we are getting stroke or somebody else is getting stroke, time is brain. 2 million brain cells dies every few minutes, every minute, every 60 seconds. So the blockage, when the blood is not reaching to the part of brain, how we can remove the blockage, how we can resolve it, how we can open it. There are a few methods. Next slide. Two main approaches are, one of them is we gave medication, very strong medication, dissolve medication, so that we can dissolve the clot, the whatever thing is clot making the blockage. We gave it through IV to open it. The second one to so how we can pull the clot, not with the catheter. You put the catheter through your leg or arm. We try to remove the clot or try to make the clot smaller. We have those technologies to do that. There are two processes, medication or mechanical thermosis. These are two procedures. They are very time sensitive. It's not like we will do it tomorrow or today, or these has to be done very quick, very fast. So again, I repeat myself, once there is a symptom of stroke, urgent medical attention is necessary. Every minute counts, every second counts. Don't delay it, call 911. They know which kind of stroke it is, what hospital we should take the patient. We will take care. Yeah, they will take care of everything. They know what to do. They know which hospital. The main process will start once you call 911. Once the patient reaches to us, we diagnose the stroke say at the same time. I'll give you an example. This is the CT scan of this is a CT imaging. We can clearly see that what kind of stroke, what part of brain is affected, how much is affected, how much is the rest. On the left side is maybe purple or pink. In this scan, we can see that like lot of area is damaged. On the left side, the green area is on the rest. So our attempt is that it could be dead, that it could, how we can prevent this area. It is also on risk, how we can save this area. Next slide, please. The one that I called about thermovectomy. These are our procedure rooms. There are very trained intervenist surgeons and neurologists. They, from our groin or from our leg or our arm, they insert a catheter. They can see it, where is the blockage, how they can remove the blockage. As you can imagine, you can see there is a lot of, we have to, so from our side and from the patient side, we have to be fast. You have to be quick. So if you are sitting at home with, then we can't help you that much, because that so much time is gone by. So once again, keep that in mind. It's urgent. Urgent help is important. Be quick, be fast. This is the picture of the angiography, like we say heart angiography. This is a brain angiograph. This is post-stroke. On the arrow on the left side, you can see those blood vessels, those arteries. You can see that artery is blocked, the blood is not flowing. Once we put medications, with the medications or with the catheter, on the right side you can see the blood is going, blood is flowing, the blood is going where it's supposed to go, in the brain, so that we can save the rest of the brain, so we can save from more damage. So this slide is there because I want to show you the flow of the stroke patient is very complex. Once the patient is in the hospital, we have to perform different CT scans, CT procedures. We have to do a lot more tests. There are medications, thermocectomy or mechanical thermolysis. These all things takes time. So that's why you can see, if there is a patient on the left, if the patient is in the hospital, then all these things, and then our attempt will be rewarding, because the patient will be cured, and it will be cured. And then I make that plea again. If it's happening to you and somebody else, don't worry to call. No, if we say, oh, the patient is okay, that there is no stroke, but bring the patient to the hospital as soon as possible, then we will see. So as fast as you can. Next slide. Risk reduction, we call it. How we can reduce the risk, how we can reduce the risk of stroke. We talked about it yesterday. We have to manage the chronic disease, high blood pressure, cholesterol, and diabetes. How three of us we can manage, we have to take care of them. There is no magic cure for this, but we can manage them. Talk to your doctor, talk to your health providers, talk to them, manage it. Yeah, prevent eating too much sugar and treat it. 2 to 3 things I want to say: healthy eating, weight loss, registered diet. Talk to registered dietitian. She talked yesterday about it, so that we can prevent any further heart disease. So exercise 30 minutes every day. So when there is a fast breathing, you are perspiring, that's the exercise we are talking about. Don't consider that exercise if you are walking around. So we cannot call that exercise. Do you do that too? I'm not saying that is a bad thing. but do a vigorous exercise like walking fast 30 minutes is good for stroke and for all other diseases. Reduce your alcohol consumption, minimize it, try to decrease it as much as you possible. It's very important. Next slide, please. We South Asian icon, why we pick up stroke? Because we know we South Asian, Punjabi, India, Pakistan areas, we are that background. So we can think about blood pressure. We have twice or three times more risk than the Caucasian community. So we have at more risk. That's why the risk for a stroke is more, because we have more risk for these diseases. If we control them, prevent them, nothing like that, so that we can prevent stroke even before it could happen. Once again, I repeat, my main message to the community is understand what is stroke is different than the heart attack. What are the symptoms of stroke? I will tell you again. Face is drooping and is losing, and then there is a weakness in the arm and the leg. When the slurred speech, the person is trying to say something but you can't understand it, they have difficulty speaking, then seek medical attention as soon as possible. Again, every minute is important. I want to repeat it, it's very important. Thank you very much.